everyone, welcome back. We are going live today with Kylee Austin, and she is going to be discussing what she treats as a pelvic health physical therapist from mind to body healing, her brand new practice with her new partner, and she is known Kylee for so long, and I just adore her, and I'm so amazed by all the amazing things that she's doing in pelvic health. Hi!
Hi!
It's both of you. I get two for the price of one.
Yep. Yay!
So great to see you guys. Is this the background in your new clinic?
Yes, we're here in the clinic, and it's just like our nice big art. I love all of it. Just in our waiting area.
That is gorgeous. I saw the pictures as you all were moving in, and every corner just looks completely stunning and like a really beautiful, restful place for patients to visit.
Thank you. That's our vibe. Yes. And now we have two spaces. So we're really excited. We expanded already, and we have two spaces, and I'll be sharing the second space here on social media soon.
That is so exciting. Did you hire other providers for the other space?
Just us. So far. We're getting there. That's the plan.
That's amazing. So do you guys want to talk about your practice and things that you commonly see as providers?
Yeah. So we commonly, our main goal is pelvic floor physical therapy. So we treat pelvic floor dysfunction, which would include bowel bladder, sexual dysfunction, and chronic pelvic pain. And then we also offer sexual counseling. My niche is more the dyspareunia, vaginismus, vestibulodynia, and Kylie's. I work on postpartum care as well as core work, engaging that transverse abdominis, all the extra elements, and getting you back to full fitness and living your life to your fullest.
That's amazing. And sometimes even better than ever after baby. I became like a faster, stronger runner after I had both of my boys. Exactly. I didn't think it was going to be possible, but it sure is when you work hard and do the right things and give yourself some grace along the way.
Exactly.
Yeah. So, go ahead.
Yeah, and then we have all of our tools here, right with us. So we like to show them off in the clinic as well. Yeah, it's so fun.
You had your sweet little bookcase with all of the products displayed, which just totally made my day. And so particularly specializing in dyspareunia, how do you usually educate patients in their initial foray into dilator training?
So, well, starting with the initial exam, where we start by looking at the outside of the tissue first, because that helps us determine what the cause of the dyspareunia might be, and then figuring out what we need to do to get the external tissue healthy, and then proceeding into the intravaginal or intrarectal exam. Depending on their level of overactivity and what's the cause, we choose, we do the intravaginal manual therapy, but then as their home program, we assign different dilators. So it would depend. The reason why I like these tiny ones, actually had two new patients this week with severe vaginismus. And I'm not even to the point where I could start a dilator, but this is going to be step one. It's the smallest one available, and it's soft, and it's the least intimidating. Mm-hmm. Instead of buying all of them at once too, because that can be overwhelming. We're just going to be like, this is where we're starting. It's smaller than my finger. Mm-hmm. So this is what I would use for someone who had really severe vaginismus, just to get comfortable with placing it inside. Before I progress them to even doing their own self-stretching. And then it would depend too, if it's post-vaginal cancer or post-chemo or radiation and the tissue's really fragile, or even post-menopause, once we get them on the right estradiol cream to help with the tissue health. I really like progressing in these sizes for patients like in that scenario, where their tissue is really sensitive, because it's soft and bendy, and they can just progress in vaginal canal length and girth, one step at a time.
Absolutely. I totally agree. Something interesting. I'm not sure if you've seen these yet.
No.
These are smallest in our rectal dilator set.
Oh.
And I specifically made them smaller than our vaginal dilator.
Okay.
They are a bit longer because they are part of our rectal set, but they can be purchased individually, and they are now the smallest on the market and available.
Smaller than this?
Yeah, so here's our smallest vaginal dilator and
Oh,
our
wow.
rectal dilators. So they create an on-ramp into the vaginal dilator training. We need to send you these. I will get these.
Yes, I didn't know. That's great.
So yeah, they are a smaller entry point. The tip here is about the size of the Q-tip, like we would use during our testing to determine if they're able to tolerate anything at all, or during our vestibular testing with the Q-tip. So yeah, 2 smallest rectal dilators as an on-ramp to vaginal training.
That's great. The camera's so misleading. It looks like it's bigger than this.
Are you serious? Oh no!
I think so.
Yeah, they're teeny.
It's longer but skinnier. Yeah, that's great.
Yes,
Awesome.
absolutely.
And I think one unique aspect of our clinic is that we have a heavily male population within our patient population. So we really specialize and work with a lot of males, and they need these tools too. So
Yes,
that's great.
That'll be a great
They
one.
totally do. Do you have the blue wand?
I love that one.
We have, it's not blue.
We have, oh yeah, the vibrating
Is that
one.
different than that one? Yeah. Okay, yes.
Yes, it's the same as the turquoise one, but we made a blue one for people who like blue.
Oh, this is my favorite color.
That makes sense.
That's amazing. And then Kylee, what kinds of treatments are you generally providing during pregnancy and postpartum?
Yeah, so I love working with the abdominal wall and being able to really heal that area and engage the core correctly. Postpartum, we're seeing a lot of diastasis recti, and just being able to close that gap and heal that tissue really well. But all of that is all obviously connected to the pelvic floor, and being able to mobilize that tissue and utilize it to the full potential also affects your ability to utilize your pelvic floor muscles.
They are a team. They co-contract before we even go to move. That's something a lot of people aren't aware of, is that the deep abdominal muscles turn on before our arm lifts to pick up our T, or before our leg moves to take a step. Our body has this very fine wiring to turn things on, but that can be disturbed by the process of elongating and carrying a baby, and sometimes during injuries with birth. But the good news is that it's all treatable and fixable, and we can retrain that coordination and manual techniques like you're describing to help heal that abdominal wall, because they are a team.
Yes. And I think also to mention that it's very important with our system and our method that we work with, we love to make sure that all of that pelvic floor musculature is not tense or tight or anything like that, like painful, before we start the exercise portion. So we don't want to engage that core and do all the things before we get the real work done. And people can come in not understanding or knowing that they may have some pelvic floor dysfunction and just want to work on their core, but they actually have an issue with the pelvic floor as well. So we definitely take the time to lengthen and strengthen the pelvic floor first, and then bonus work, we get to work with the core.
And add the fitness overall health component to it.
Yes, and that way you're setting the cornerstone, which is going to be what we put everything on. So the old adage is lengthen before strengthen. That's a question that comes up with a lot of new practitioners and then patients that don't understand. And so many postpartum people want their core back, and so they're doing whatever fancy little exercises they see on Instagram.
Exactly. It's great because you know Dr. Sarah has had over 12 years of experience in this field. I am a new grad myself, And I like you said, new grads, we just want to like throw every exercise at them. We're like so excited that we know everything about all the exercises. And Dr. Tara was able to like reel me back a little bit and realize like, hey, there is a process here, and to make sure that those muscles are addressed before we start anything that is going to continue to aggravate that, and then actually extend the plan of care, right? We want to get that done first.
Yeah.
Kylee, you're not alone. We all did it. Don't you worry. And you're not the average new grad.
No, she's not the average new grad at all.
No. I met Kylee when she was a second-year student, and you already had a profound understanding of pelvic health. You already knew what you were here to do. You are truly exceptional, and you two as a pair is, I mean, you're going to be helping so many people with your new practice. It's incredible.
That's the hope. Yeah, and we're all honestly, we're just a great complement to each other. And right now we're working on trying to get all of her knowledge and mentorship out there to the world as well for other pelvic health providers. And that's going to be all like available online, but we're also going to be, you know, on my end, emphasizing the exercise as well. So there's so much going on right now.
It's such a complimentary pair. And Kylee, you were just up at the Capitol doing some advocacy work. What was that like? What did you do? I saw pictures.
Yes. Well, the big fun part was that I got to walk around DC in a vulva costume, so that was amazing. Did about 7 miles in that costume and got all the looks, all the cameras, all the everything. So it was really fun.
But she did get a parade to stop and cheer her.
Saw that. Kylee stopped an entire parade.
So yes, trying to spread the good news about pelvic health, basically, and women's rights and awareness of these services that we provide. But really, I sat down with our Congress people, and I was able to share basically my personal postpartum story, where a doctor looked at me, my gynecologist that delivered my babies, and said, you know, you're fine, you're fit, you don't need pelvic health. And that just shocked me to my core, because really you can't tell what's going on with your pelvic floor just by looking at someone from the outside, right? And I believe, and I personally believe, that we should have pelvic floor therapy as mandatory standard of care, yes, after every delivery, no matter if it's C-section or vaginal delivery, it needs to be there and provided and
covered by insurance.
Exactly.
Automatically.
Exactly. So I was able to share that story, and particularly the APTA, our American Physical Therapy Association, and the pelvic health section within that, is supporting a bill that all physicians be trained in what pelvic floor therapy is, and basically kind of tell them that you need to be referring to us. And so that is kind of what the bill is that we're working on going forward in Congress itself, and it's just a great thing to be a part of.
That is phenomenal. Our colleagues in France have had this dialed for over a decade. So it is embarrassing that we're not there. I'm so thankful for people like you for helping to continue to move it forward, because it absolutely is a vital part of that 4th trimester, which was just recently recognized by ACOG.
Yeah, and you understand that we, like, as physical therapists, have so many skills that can benefit these mothers, and with the high mortality rate of maternal mortality rate in the United States, we just need to be there and be accessible for these patients.
Absolutely. And that's just it. Kylee, you had a whole full life before you even went to PT school. You had 3 children before you started your doctorate program, right?
Yes. Busy mama. So it's amazing to be on the other side of that journey. But yes, I would say it's a big deal to have kids going through my doctorate program, but like, that definitely drove me towards having, being with the pelvic health profession. And I feel like giving back to mamas in need is super important on my heart.
Absolutely. And then Tara, I think the statistics are that everyone is going to experience some level of sexual dysfunction at some point in their life. And I think a byproduct of things that happen in our life, from injuries to hormone changes to changes in our relationship status that result in physiological changes in our bodies. So the work that you're doing to help people overcome sexual dysfunction is also so important, and one of those activities of daily living that often goes untalked about, but that can deeply affect people.
Yeah, and we do treat the physical side of it, but I also offer sexual counseling because there's such a huge emotional and mental and psychological component to it that we can't not address. We can't just say, oh, this is what's going on with your muscles and not look at the rest of the mind. And so we incorporate sexual counseling here as well. That's why it's mind to body healing.
The whole thing.
The whole thing.
You cannot take the two apart.
Mm-hmm.
That's amazing. I think one of the biggest things too that a lot of people don't realize is that just purely using enough lubricant, either with the tools or with their partner, is like a big step in overcoming a lot of the penetrative issues that they have as well. That is just such an easy fix, along with dealing with the coordination and tissue issues.
Mm-hmm. Yeah. We always say lubrication is important whether you have sexual dysfunction or not. You know, wetness is not always a sign of arousal. It's not a direct correlation. You can be very aroused and not get wet, or you can be very wet and not be aroused. And so lubrication is just a must. But we also want to get to the reason, if there is a physiological reason why you're reliant on the lube, or if the lube isn't enough. Those are things that we need to address too.
Absolutely. What do you do when you find that the lubricant is enough?
That's usually a hormonal sign, so they probably need just vaginal estradiol cream, or if they've been on oral contraceptive pills for a long time, under the age, if they start especially under the age of 17, and they've been on it long term, then they might need a combination of an estradiol testosterone compound cream to help heal that tissue.
Absolutely. Absolutely. That's phenomenal.
Yeah, and we have so much fun, like on our social media and our page, and speaking to people in different ways, but really we're trying to break down the stigmatizing of the instruments, and like of just like talking about sexual function in general. And I think it's so important that we're out there, you know, breaking down the barriers and talking about these things on IG Live or wherever, so that people can see that, like, when I was younger and I was in pain myself, for pelvic pain, like, I didn't know that any of this was a thing, and I was just alone in my bubble of pain, and doctors telling me I'm crazy and it's all in my head and all of these things. So, like, I don't want anyone else to feel that guilt or shame surrounding like sex or pelvic pain at all. And it's just not we as women, I would say, we kind of we just normalize those things, like, oh, it's normal to pee my pants, it's normal to have like pain with sex and things like that, but it's not. It's something that we can actually address, and these tools definitely help us out.
You are so right. People feel so alone, and the more that they're seeing it out there talked about, the less stigma, less shame, and the more likely they are to go and advocate. And when we're telling them what we've all been through, because we've all been that patient on the table, and telling them to go look for a provider that does listen, that the tools are here to help, and that it is common, but it is fixable. I think that's where there's a massive change, at least in the last 3 to 5 years, that I've observed.
Mm-hmm. Well, we just want to spread the message to everyone that there is hope. They're not alone. And healing begins with hope. You know, a lot of people will leave the first session already feeling better because we've instilled the confidence that they need and that we have to help them all the way to reach their goals.
And that's just it. Confidence in themselves and confidence in you, because you have listened and understood and
validated. Yeah.
Mm-hmm. Therapeutic alliance.
Yes, therapeutic alliance, exactly.
I love it. That's amazing. Is there anything else that you want people to know about your education and your practice and your favorite Intimate Rose tools?
Well, as far as education, we're both doctors of physical therapy, and like Kylie said, I've been practicing for 12 years, and I also teach courses for other healthcare providers on differential diagnosis and pain science, and it's just my favorite thing to do, this field. Yeah, and we started the company in March, and we're just trying to take over the valley.
Yeah,
the word.
Yeah, so we're located in Phoenix, Arizona. If you guys are not familiar with Mind to Body, and we look forward to providing care to anyone within this area, but we're also available online as well. So
Amazing. I love it. I've loved watching you guys grow. I'm coming to Phoenix in August 17th and 18th for an occupational therapy and pelvic health conference, but I would love to see you then.
Absolutely.
I miss you.
The three of us live in your clinic.
Yes.
That would be great.
Wonderful. Well, thank you, Dr. Tara and Dr. Kylie. I appreciate you, and I am in awe of how fast you guys have grown. Please keep up the great work. And if anyone is watching and in the Phoenix area, definitely check in with them at Mind to Body. They are doing amazing things.
Thank you so much.
So are you.
Yes, you are our champion for women in business and entrepreneurs. So great job.
Thank you so much. Well, I can't do it without my people, and y'all are my people.
Yes, we are.
All right.
Love it.
Thank you, and have a great